Elizabeth. I'll be your nurse today.
Hello.
How are you doing?
Good, how are you?
I'm pretty good. Could you just verify your name and date of birth for me?
Adriana Carrasco, 11/23/1988.
All right, and would you like me to call you Adriana?
Yes.
Okay, great. Adriana, do you have any allergies?
No.
Okay. Are you having any pain today?
No.
All right, no pain at all. That's great. So today we're just going to do a head-to-toe assessment. So I'm going to start with your head here, and I'm just
Okay.
going to palpate your skull.
Okay.
No deformities or head is normal cephalic, no lumps or depressions noted. Next, I'm just going to separate your hair in a couple places.
Okay.
Inspect your scalp. All right. No scaliness, lesions, erythema, or nevi noted. And hair is in good condition, evenly distributed, and soft to the touch. Next, I'm just going to have you make some facial expressions for me.
Okay.
Go ahead and raise your eyebrows, frown, smile, show me both rows of teeth, and puff your cheeks out. All right. Great. And then close your eyes and try to open them. All right, great. So it looks like cranial nerve 7 is intact with all of those facial movements. Next, I'm just going to palpate your temporal pulse. That's +2 bilaterally. Great. I'm going to have you move your jaw for me a couple ways. So first, clench. All right, masseter and temporal muscles, 5 out of 5 bilaterally. Go ahead and open up. Move side to side and protrude your jaw. All right, no clicking noted, and full range of motion of the temporal mandibular joint, so that's great. Next, we're going to do light touch, so go ahead and close your eyes and tell me when you feel something.
Okay. Yes. 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 Yes.
All right, and was that the same sensation on both sides?
Yes.
Great, so that's cranial nerve 5 sensory is intact. Awesome. Next, I'm going to go ahead and inspect your external eye structures. It looks like your eyebrows and eyelashes are evenly distributed, no ptosis, and your eyelids are in good condition. I'm just going to pull down on your eyelids. Look up for me. Conjunctiva are pink and sclera are white, so that's great. We're just going to do a couple of eye tests here.
Okay.
So start by just following. Great, so eyes move parallel in the 6 cardinal directions and convergence is expressed. And then next I'm going to do a couple light tests here. So I don't see any cloudiness or scratches on the cornea or lens. Corneal light reflex is present. And finally we're going to assess your light reaction here. Great, so pupils are equal, round, and react to light. Go ahead and look over my shoulder and look at my finger. All right, and accommodation is present as well. Cranial nerves 1 and 2 are intact. Okay, so next I'm going to move on to your ears. First, I'm just going to inspect. It looks like your external ears are symmetrical. Skin is in good condition. I'm going to palpate. Tell me if you have any pain. The pinna, tragus,
No.
and mastoid process.
No.
All right, no tenderness noted bilaterally. Now we're going to go ahead and inspect. All right. Internal ear canal looks intact. Tympanic membrane is pearly gray and the cone light is bright bilaterally. All right, so that's all normal. I would repeat that on the other ear as well. So next I'm going to do what's called the whisper test. Just repeat to me what you hear me say. And close your right ear for me. All right.
157.
Great, good job. All right, so next we're going to do your tongue protrusion. So go ahead and stick your tongue out for me. And, or I'm sorry, we're gonna next I'm going to inspect your nose
Okay.
for any deformities or lesions. Nose looks symmetrical. Obviously I can't see it because of the mask, but what I would do is I would have the client tilt their head up and inspect the internal nose. Note that the mucous membranes are pink and moist, as well as the turbinates. No septal deviation or perforation. I would have my client occlude one nostril at a time and breathe in to test for patency of the nares. Then I would move on to the lips. I would note they are pink and moist. I would instruct the patient to open their mouth, inspect the pharynx, the floor of the mouth using a tongue depressor and a lighted source. The gums and the teeth to note that they are all intact and no lesions are present or any lumps. And then I would instruct the client to say ah and note that the uvula remains midline and the soft palate rises symmetrically with phonation, cranial nerves 9 and 10 intact. Then I would have the client stick their tongue out and note that there's symmetry, which means cranial nerve 12 is intact. All right, next we're going to do some neck range of motion. So I'm just going to have you look down at the ground, up at the ceiling, head side to side, and ear to shoulder, ear to shoulder. Great, so full range of motion of your cervical spine there. Now I'm just going to have you move, try to turn your head against my resistance, right, and this way. Perfect, all right, so that's full strength, and then we're going to do a shoulder shrug test, so try to shrug your shoulders. Great, so that's all cranial nerve 11 intact. All right, so moving on to your neck. First, I'm just going to inspect it. I don't know any lumps. Is there any tenderness?
No.
All right, trachea is midline. Great, so what we're going to do next is we're going to palpate your lymph nodes. We have pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, supracervical, deep cervical, and superficial cervical, and posterior cervical, and supraclavicular. Any tenderness with any of that?
No.
All right, great. So no tenderness or swelling of the lymph nodes noted on either side. Next, I'm going to move on to inspecting your backside. So it looks like your skin is in good condition. Everything is symmetrical. I'm just going to palpate. Any tenderness?
No.
All right, no crepitus or spasms noted. I'm palpating each vertebrae. It looks like the spine is in good alignment. That's all great. Then we're going to go ahead and listen to some breath sounds. So I'm just going to sanitize my stethoscope here. All right, just take a deep breath in through your mouth each time that you feel my stethoscope.
Okay.
Great, so no adventitious lung sounds, all clear to auscultation bilaterally. Next, I'm going to inspect your anterior chest. All right, it appears your breathing is non-labored and no accessory muscles are being used, so that's great. I'm going to go ahead and take a listen to your lungs in the front now, okay?
Mm-hmm.
Just take a deep breath in just like before. great. No adventitious lung sounds heard in the front either. All right, so next I'm gonna go ahead and inspect your shoulders. Let me know if you have any pain on palpation.
No.
All right, great. No pain or tenderness or swelling of the shoulders. We're gonna do some shoulder range of motion now. So go ahead and follow with me. We're gonna flex, extend, external rotation, internal rotation, and we're gonna adduct and abduct. Abduct. All right, so that's full range of motion of that shoulder, and I would obviously do that on the other side as well. So now we're just gonna move down to the elbow and palpate. Any tenderness with that?
No.
All right, no lumps or lesions, skin in good condition, no deformities, and elbows are symmetrical. All right, next I'm just gonna feel your brachial pulse while we're here. And that is +2. Those elbow assessments would also be done bilaterally. All right, moving down to your hand. I'm just gonna inspect your wrist. Any pain with that?
No.
All right, great. Skin's in good condition, no bogginess, swelling, or pain in the wrist. We're gonna do some range of motion now. So let's start with your elbow. Flex, extend, supinate, and pronate. And then we're gonna do some wrists. Flex, extend. We're gonna ulnar deviate and radial deviate. Spread your fingers apart and make a fist. Great, so that's all good. We're gonna do some strength as well. So just hold your arm at 90 degrees. All right, don't let me move it. And I'm gonna push, don't let me move it. Great, all right, I would repeat that bilaterally as well. That's 5 out of 5 strength. And go ahead and squeeze my fingers. All right, 5 out of 5 strength bilaterally for the hand muscles as well. So next we are going to do some pain sensation. So there's going to be a sharp touch like this and a dull touch like this.
Okay.
Can you tell that difference?
Yes.
Okay. Go ahead and close your eyes and tell me what you feel.
Sharp. Dull. Dull. Sharp.
Great, and that would be repeated bilaterally as well to note that the pain sensation is the same on both sides. All right, I'm going to take your radial pulse. That is +2, and that would also be done bilaterally. Next, we're going to do your arm reflexes. So first I'm going to do is the triceps reflex, so just completely relax that arm on me. There you go. All right, great. Next we're gonna do the biceps reflex. Great. And the brachioradialis. Great. So all reflexes are present. That would be repeated bilaterally as well. All right, so the next part of our assessment you can lay down for. So I'm going to raise the head of the bed up to 30 degrees and help you lay back here. And we'll get this out for your feet. Are you comfortable?
Yes.
Okay, great. So first I'm just going to feel for your pulse here on your carotid artery. One at a time. And those are +2 bilaterally. Next, I'm going to feel that apical pulse. All right. Apical pulse is present and palpable. All right, now I'm going to listen to your heart sounds. All right. Aortic. Pulmonic, Erb's point, tricuspid, and bicuspid. All right, and then turn onto your left side for me. I'm going to use the other side of my stethoscope and just feel that apical. Okay, you can come back on your back now. Now listen. The tricuspid, Erb's point, pulmonic, and aortic. Alright, so S1 and S2 heart sounds were heard, and no adventitious sounds, so that's great. Next I'm going to move on to inspecting your abdomen.
Okay.
Alright, so it looks like the umbilicus is midline, skin is in good condition, no visible pulsations or masses. I'm going to go ahead and listen to those bowel sounds in the right lower quadrant. Okay, great. Bowel sounds were noted, and this would be done under the clothes as well as the heart and lung sounds normally. All right, now I'm just going to palpate a couple places. Tell me if you have any pain or tenderness.
No.
Any pain here?
No.
Or here?
No.
All right, great. Moving on to your hips. So they look nice and symmetrical, in good skin condition. I'm going to palpate here. All right, no swelling, no lumps felt. Any pain with that?
No.
All right, great. So that is all in good condition. We're going to do some hip range of motion now. So go ahead and bring your knee to your chest and extend it out to the side, across your body. Now we're going to bend it up and we're going to turn your foot in and your foot out. All right, great. And this would be repeated bilaterally as well. Moving down to the knees. Knees look symmetrical. Is there any pain or tenderness with this?
No.
All right, great. No deformities noted. Skin is in good condition. No mass is felt. I'm going to feel your popliteal pulse on the back of your knee here. Great, that's palpable +2. That would be done bilaterally as well. Next, I'm going to check for edema. I'm going to press here for 5 seconds. All right, 0 millimeters. So you have no swelling bilaterally. That's great. Moving on down to your feet. I'm going to feel them. Let me know if you have any pain.
No.
All right, awesome. And then we're going to do a little range of motion. So point your toes to the ceiling, toes to the floor. We're going to turn your foot inward and turn your foot outward. And now we're going to do that with some resistance. So point toes to the ceiling and toes to the floor. All right, strength is 5 out of 5, and we would repeat that bilaterally as well. Next, I'm going to just let you sit up here. All right. And I'm going to take your hand here and just test your capillary refill. All right, less than 3 seconds. No clubbing of the fingers is noted, so that's great. We're going to do some reflexes here. Your patellar reflex. All right. Achilles reflex. And plantar reflex. All right, great. All reflexes are present, and that would be done bilaterally as well. Next, we're just going to do sharp and dull touch. So again, this is sharp and this is dull. Tell me what you feel.
Dull. Sharp. Dull. Sharp.
Great, and that would be repeated bilaterally as well to tell if there is symmetrical pain sensation Well, I believe that concludes our assessment today. Oh, actually, no, it does not conclude our assessment today. I need to take a pulse on your dorsalis pedis. All right, that's +2. And your posterior tibial pulse. That is +2 as well, so that is great. It looks like now we are completed with your assessment. So all your findings were normal today. Do you have any questions for me?
No.
All right, great. Well, it was nice meeting you, and the doctor will be in to see you soon.
Thank you.
All right, have a good day.
Bye.
Turn it off.